What's up, guys? Welcome back. Episode who knows what. I'm Lubo, that's Ian, and Dr. Dan Dworkis here.
Dr. Dworkis.
He insisted on putting doctor in front of his
I
name.
definitely did not.
Because we usually introduce people by Mr. No, he didn't. He didn't have that.
He said I earned it.
Yeah, he says I earned it, and I'm proud. Listen, I just want to ask you something before we start. Because that's gonna tell. Yeah, but that's gonna tell enough about you, pretty much. But you did have, or you still have a podcast.
Yeah, absolutely.
Yeah,
Emergency Mind.
Yes. Emergency Mind.
That's right. And a book of the same.
And a book of the same name. It's
Right.
probably on the bookshelf over there somewhere, actually. But.
I think
Oh, you have it there?
I think I took the one that was.
Oh, did you? Nice.
It's
good. It's in use. It's good.
What is the podcast about?
So, it's about performing under pressure, give or take. It's about the idea that you can learn something and have that knowledge, but then the gap between knowing that in theory and being able to apply it in reality is very, very, very big. So it's about crossing that gap, about applying knowledge under pressure.
It's kind of like like me and Jiujitsu.
It actually is very similar, right? Like you can learn
I was
you
thinking a
do a
similar
technique,
thing.
right? You're like, oh, I got this crazy, and then you just get crushed because, or at least I get crushed. Usually, by
Just
one
like
of
what you
guys.
mentioned today earlier
Yeah.
about drilling.
Yeah.
You said something like everyone can learn by drilling, no matter how you learn, by repetition.
absolutely.
Doesn't matter
But
who learns how.
Right.
Anyone can learn with drilling. Now,
But you're
whether
like, there's a difference between just doing it over and over and then doing it while you're going live with somebody.
Yeah.
That's the thing. And when you go live with somebody, it not working, and then you going back to what you're comfortable with and leaving that behind.
right.
Instead of sticking with it. And
But that's obvious in some sense in martial arts, right? Because like you learn a thing, and then you try to do that thing, and you get punched in the face. And you're like, well, that didn't work. And then you go back and you do it again, and you do it again, and you do it again. In medicine, in a lot of other places, it doesn't work like that. Like there's not this culture of, okay, well, let me go back and take it apart and drill it and put it back together and make sure it's ready to go again. And so a lot of the time in the podcast, we're talking to folks about how they do that, right? Like how do you learn to be a better firefighter? How do you learn to be a better, doctor? We had this one amazing woman who ran like risk for a huge oil and gas company. And we were like, how do you think about the way that your team actually solves problems?
wow.
So, yeah, it's cool stuff.
That's nice. No, it's cool because it's not something
Isn't that special?
Yeah, isn't that special? Because it's not something that a lot of people think about, performing under pressure.
Like you think you'll be able to, like the fighters say, I'll just turn red. You think you'll be able to perform in a way that you imagine yourself to.
Yeah.
But reality is different.
Yeah.
I learned that when I first started in security 100 years ago, bouncing in bars. The first 3 months I was working, nothing happened. And the bar that I worked had a reputation for not violence every night, but a couple of times a week something went down. And then I started and nothing went down. But I remember the first time something did go down, and it was kind of like, I've heard other people tell stories where things got really slow.
Yeah.
Like things were moving in slow motion. Once, a good buddy of mine, a guy grabbed him. And that's what alerted me. I was like, it's real now. Like, I got to make sure my buddy doesn't get... I have to, I have to go to work now. And things got real quiet, and I just reacted, put the dude to sleep. That was the first time I ever used jiu-jitsu in a real-life situation, and it worked. And I was like, oh, my gosh. Like, it felt powerful. But I was thankful that I guess I trusted enough in my abilities or skills that I wasn't scared when it came time to do it. Because some people get into situations where they get overwhelmed.
Sure.
Like I've seen that happen at times, and I've heard stories of that happening too. And I'm proud that I reacted in a way that I hoped I would have, at the time.
Yeah.
Because
But
you never know how you're going to react
it's
with
also,
something, especially
it's
the
also
crazier,
training,
the
right?
crazier it is.
Yeah.
It's also
it's
training.
also training.
Sure.
It's
I didn't
training.
I didn't
It's
think
part
a
of-
lot. It was just my body just started reacting.
Right,
I got the dude in the choke. And back him up.
I've never had to use jiu-jitsu in such a situation, outside the gym.
Yeah.
I've never had to, and I don't really want to. I'm curious how it'll play out, but I kind of know because how many idiots. What am I saying? there are idiots in the streets, but what I meant was how many people walk in for the first time, in the gym, and they're like buff and they don't know anything.
Sure.
Right.
And then you just choke them out in the first 30 seconds, and you're like, oh, that's how it's gonna go, unless I get hit in the head before that,
Yeah.
Right.
Yeah.
Yeah, you see that, right? And you see that when you first start, you have this instinct that you all have. Everybody has that. This just like push away, like get me away, or like I'm gonna, and then over time you realize, wait, actually I need to retrain that instinct.
Right.
Instead of doing this, I need to do this, and like
100%.
I need to,
That's a great point.
And that only comes through. That only comes through training. That only comes through practice and through purpose and like that.
Well, what do you
do? I just want, before we get too far, I guess I'll just ask it, even though I know the answer. But why are you? I don't want to say qualified, but why did you write that sort of book?
I thought you were going to say, why are you qualified to talk about jiu-jitsu? And I'm like, I'm not.
Yes, you are.
To talk about jiu-jitsu.
You came to my class the other day. You are qualified,
dude. You did.
No, you took one class with me. You're qualified.
Your body remembers.
Yes, sir.
Yeah. It wasn't like you coming back from day one.
No, it's true. But so I'm an ER doctor by training, right? So
Which is crazy.
Yeah, it's
because
pretty cool.
all the scary stuff goes through the ER usually.
Yeah.
You get the whole spectrum of stuff.
Yeah, we do.
There's a couple like YouTube guys that I used to watch. One of them was the ER nurse, and he would like his little ER, the equation that he did. He would reenact the craziest stories of people coming into the ER that he remembers.
Yeah.
And some of them were so bizarre, and I was like, dude, I don't know how I would react with something like that. And I remembered, and I'll let you expound on it, and we've talked about this before. In the beginning of your book, it might have even been in like the preface or whatever, you talked about the first time, I think it was like a heart patient, it was something traumatic happened.
Yes.
And it was like, they were like, you were just out of school or something, and you just found yourself in charge of something, and you had to kind of rise to the occasion, and you kind of, what I call like, you trusted in your jiu-jitsu, you trusted in your teaching, and you kind of did what you had to do. In that moment. And I just thought that was really special because when I was reading, I remember it was kind of dramatic. And I felt it. It was like, oh shit, I'm ready. I'm trained to do this, but like this dude is like in trouble. And you kind of made it happen. And I was just like, that's my friend right there.
Yeah. Right on, man. I appreciate that. Yeah. Yeah, it's intense. I mean, I love emergency medicine, right? I love it because out of most of the stuff, we can talk about healthcare, we can talk about whatever you want, but a lot of the healthcare system is designed to sort of like move people through things. But in the ER, like our answer is yes, we will try to make your life better. Like, do you need a sandwich? Have you been stabbed? Is there nowhere else to go? Like, cool, we're going to try to make it better. And that team ethos of it, and like there's a bunch of ER doctors in the school here, right? Like a bunch of people that work in the ER here, and like that ethos of like, yeah, cool, I'm gonna try to make this better with whatever happens is just, I think that's a really powerful way to look at it.
Have you ever felt as though that you've been not overrun or overwhelmed, but there was so much going on that you were just like, oh my gosh. And then what do you do, because you can't lose your mind, especially because you're like in charge of stuff. Like you're in charge of other people and stuff.
Yeah.
So you can't go crazy, obviously. But what do you do in situations like that?
We had this one nurse who I loved when I was training, and she was the most badass person. She's just like salt of the earth and incredible, and I can still hear her voice sometimes yelling at me to do things better when I'm like, in the middle of doing whatever. But this woman would I've never seen her miss an IV in my entire life. And one time she put an IV in and no blood came out, and I was actually, I was like shocked, and I'm like, oh my God, you just like broke my faith, like you never miss. And she looks at me and goes, Dan, maybe you could do some better fucking CPR. And we did better CPR, and then blood came out. Anyway, all of which is to say that one time we were working this case together.
See, I didn't know that the blood came out with the better CPR, so I didn't get the fucking joke.
It took me a second.
That's a very that's an inside joke, and we're obviously not inside
the we learned it in a second.
I know, right?
We picked it up. Context clues.
Yes. Now I know.
Yeah. She was like, Bitch, what you talking about?
Exactly. So we're
That's
working
cool,
this case
though, that
together.
she could do that.
Yeah.
And that y'all have that relationship.
Oh my God.
You know
She's
that
awesome.
you know that I've heard doctors. I heard a doctor say that.
Dr. Pepper.
Dr. Pepper. No, I heard one doctor say that because I just haven't had enough conversations with doctors, and it never came up. But I remember my wife was pregnant, and we were dealing with a doctor during pregnancy, right? And then the doctor moved out of that clinic, but we kept going to the same clinic, and a registered nurse took over. This lady that has been there years and years, right? She took over, and because we were talking the exact same things that she literally took over from the doctor when he left, and we kept talking about the same things, and you know how the progress of the pregnancy goes and all that stuff. And then we go to a place. I can't remember how it went, what the reason was, but we went and spoke to a doctor in a different clinic, and and we showed him documentation from that other place. Nothing wrong, but we just showed him history, and he goes, which doctor did you talk to? And we said this and this, and then this and that. Then he left, and then this one. He's like, oh, she's not a doctor. She's a nurse. She's a registered nurse. Like very condescending. And I know that
I thought it was the other way around. Like doctors would look up to nurses, kind of, because
you would think so, because you fucking
or they appreciate what they go through.
Right? You would think so, right? But I've heard of cases like that because we have a lot of nurses here, or at least we had. I don't know now, but we have a lot, and I've talked to some of them, and they're like, some doctors are just like they're like this. They're assholes. They're unappreciative, and maybe not assholes, but they're like a little condescending when it comes to
I know for a fact in my heart, Dr. Dworkis and Ross aren't like that, because I feel like I know their hearts.
Ross also works in emergency.
He does.
He still does once a week.
And he's also like in charge of stuff, which is what I love. That I'm like the two
How many doctors are in emergency? I guess depending on the size of the emergency.
It depends.
Room,
there's a bunch. Yeah, it depends on the size.
But like the size of the Santa Monica one, it's like what, 2 doctors on shift?
You know, I don't know how they're staffed. I mean, I've worked in places where I'm the only doctor in the whole hospital. Sometimes I've worked in places where there's dozens and dozens of doctors, and it just sort of depends on like, the flow of stuff. And
that's a crazy spectrum.
Yeah, it's
Bet
really
you Friday and
You're
Saturday
the
night is
only
busy.
doctor on the spot. That's gotta be pressure, right?
That was fun. It was fun. I mean, it was amazing. And again, like why you respect the team, right? Like you love it. Like everybody's there to try to make a difference.
Do you feel that all that pressure and the stress? It's a stressful job, I'm assuming.
It does have its moments.
It could be more stressful than being a cop, definitely. Because being a cop is like a lot of time, and then something happens. In your case, it's probably like all the time something is happening.
Well, there's always like death and trauma around.
That's what I'm saying, and then
that's gotta be like,
even if it's not death, it's still like a lot of
people coming in all torn up.
Yeah.
But I don't know if I'm too sensitive or too empathic, but like when I see somebody like all beat up, I feel that.
Yeah.
Like
it's because you're a human. You should.
I couldn't imagine what it would be like being like a doctor.
Okay.
Like seeing it all the time.
Well, what's the flip side of that, though, right? And I'm not discounting what you're saying, because it's totally true, right? It is hard. It's stressful. There's a lot of blood, and there's like a lot of sad things that happen, and like I don't think there's any way to weigh suffering. Like there's no way to answer is it more or less stress than a cop or anything. Like there's just like a different pattern, a different thing, a different sort of like framework. Like I mean the stuff that they go through, like so much like people against them, and like sometimes directly trying to hurt them and everything. It's very different. Very different. The only people that try to throw punches at me are usually on some substance or something. Or
have you ever had to use your jiu-jitsu?
Oh yeah.
Really? Because Ross told me he did too.
Ross did. Yeah.
All the dude was like,
I'll tell you the story about Ross. But when did you have to do? What did you have to do?
Many times,
like
people throw punches or get
and it works.
You're so surprised that it worked.
No, I just love hearing that.
Yeah, I mean, it's usually not. It's not like thankfully most of the time it's not a trained individual who is intent on hurting you.
Right.
Right.
But your jiu-jitsu worked out in the real world.
It's a lot more of just like you're like, okay, I'm gonna mostly my concern is I don't want them to hurt the nurse.
Sure.
Or I don't want them to punch my junior doctor or whatever. And I'm most, you're
It's
like,
a good thing
all right, well,
you
here's some
were around,
angles
though.
and here's some things, and you're just gonna like off balance the person a little bit
Yeah,
and sort
I
of
love
like
that.
make this
I
happen.
love
And,
that.
we have great teams that respond to that kind of stuff too. But just to go back to what you're saying, like the flip side of everything you're saying is what is the, what is the virtue that comes from that? And I think it's that you get to go up to bat against really big, really hard life and death things at a frequency that most people don't get to go up to bat against it. And it can crush you, and there are times when it crushes you, and sometimes it also can sharpen you and make you into this other thing. Like there's no way I would be the human being I am today at 41 with 41. I'm 41. I think about that.
I had to do the same thing.
There's no way I'd be that person without that like friction and that pressure from it for so long. And like I don't, I it's hard as hell, but I wouldn't be me without that.
Right. Can you tell like a marked difference between the Dr. Dworkis now and the Dr. Dworkis that I was talking about that had to deal with that situation in the beginning of your book?
Yeah.
Is it drastic? Like if you met him right now, would it be like, oh, you're way different? We're way different than what we...
I hope that's true, right? I mean, that person was like 20-something years ago, right? Like, I hope I've grown. I hope I can look back in 20 years from now and be like, man, that guy was an asshole.
You've always worked in emergency room all that time?
Yeah. Well, give or take, like med school and...
Yeah, no, but I mean, like, as far as your medical career...
so you pick a specialty. It's like the Harry Potter sorting hat, right? And then
Right.
like my specialty is emergency. It's just like Ross.
Yeah.
So you obviously liked it, or you felt as though you're doing enough good work that you never wanted to... man, I want to go into, like, ophthalmology now, or I want to be a podiatrist now. That never...
It's kind of like...
or would that even be possible?
I mean, so one of my friends did it recently, right? So he had done a number of years of emergency medicine and switched gears and decided that he really wanted to try a new thing and went back into training and is now a phenomenal doctor doing other stuff.
Wow.
And his patients are lucky to have him, and it's great. I don't know. I don't see that for me at the moment.
Do you feel powerful where you are now? And it's like you can do a bunch of good. So you're like, I'm fine where I'm at. I'm crazy powerful, and I can do a lot of good work with that.
The way you told the story about, and I'm curious if this feels the same way, right? The way you tell the story about being a bouncer, or the way that some of my, friends in the military tell it, right? You're like, you don't want something to happen, right? But if something's going to happen, then you're glad you're there for it.
100%.
And so it's not powerful in the sense of like, look at how cool I am, right? But it's like, look, I don't want anybody to get sick, but if they're going to get sick, I want them to come to me so I can try to like go bad against it.
I agree.
And like,
I love that.
it's not, I don't know, it's not about you, right? Like you're just there's this great word that I learned recently, which I'm going to butcher the pronunciation of, but I think it's pronounced whakapapa. And it's a Maori word.
Excuse me?
Whakapapa?
Oh, we don't use that kind of language.
This is a family podcast. I'm sorry, guys.
I've never heard that word. Podcast.
Dr. Dworkis, you surprised me.
I have never heard that word before.
Yeah, for real. Whakapapa. I think it's spelled with a W for what it's worth.
No, it's okay.
You said it's Maori?
Maori.
Okay.
And it means something like you are the dream of your ancestors. Basically, like everything that you can do is because of what they've done before you. And I think in medicine we really feel that, right? Like I can do what I can do because of all of the other doctors and nurses that have come before me. And when I was in medical school, we had these amazing things up on the walls, these statues of these old doctors, like back all the way to like Imhotep from the Egyptians and like whoever else had sort of figured out your heart does this and your whatever does this and let's try leeches and whatever. But like you realize like you're only here because of all of these other humans that have stayed up in the middle of the night trying to keep somebody alive when things aren't going well. And I think there's a similar spirit to that in fire. There's a similar spirit to that in military. There's a similar spirit to that in some sense in jiu-jitsu, right? Like you're like, here's the lineage of like how you trained and who you are. And like, we're here doing this because of this. And like, that's, I I don't know. For me, that's such a cool piece of it, right?
It sounds pretty cool.
There's
Yeah.
like that spirit behind it, and it's got a cool word. So now
Let me tell you something about the
The
Maori.
more you know, man.
Let me tell you something
The more you
about
know. I remember those.
the Maori live in New Zealand, right?
That's the ones who do the haka.
Yeah.
Yeah.
They know exactly what they're saying. They fucking speak English there. All right, whakapapa is just you know, it's not an English word. No, it's 2 English words. 3, you know. You're right. You can say whatever.
Leave it up to this
Whatever
guy.
language you want to say it is. They speak English there. Don't tell me that.
That's very funny and not true, but I love it.
I'm with you, Dr.
speak Maori?
Dworkis.
No.
Then how do you know it's not true? You speak English. You know exactly what you're saying, right? But anyway, let me ask you something. Which should I ask first? Let's see. We'll do this first. Remember how we were talking about, it wasn't that long ago, I'm sure you remember, about the acting under pressure, right? So
I do remember. Yes.
Yeah, it was a couple of minutes ago. Do you believe in that's a serious question. Do you believe in visualization? You know, like when I say that we were talking today with Ian, you weren't there, but we were talking with Ian about the drilling, right? Like that I was saying that every person learns differently,
Sure.
and with whatever it is, you know, we're not talking jiu-jitsu only, but I do jiu-jitsu, so for me it's like observation of that. Every person learns, well, not every, he and I may be learning, and all 3 of us might be learning the same way, which someone else doesn't respond to, but everyone, absolutely everyone, I believe, will learn with drilling, and we've spoken about that time and again, which is the best method. Everyone will learn with drilling as long as they're willing to follow up under pressure. So whatever they've drilled, try it out under pressure in different forms and varieties and variations of what the drill is about. So let's say CPR, just a simple example, right? You learn how to perform CPR because, you know, I've done a CPR course, and it's like you learn how to do it, but I've never done it on anybody that's dying, right? Or whatever, you know, like so there's a difference. So I'm thinking, okay, I've learned it. I remember, you know, you put your hands in all that stuff, which probably I'm doing wrong right now, but still, you put your hands in all. But then, it's okay, I know that, right? Maybe I'll save a life one day. The thing is, I've never done it. I've never even practiced that shit. You know what I'm saying? I've never even done it like drilling and drilling and drilling.
Yeah.
But if I visualize it, drill it a couple of times maybe, you know, like you do, and then visualize it maybe once a day or something like this. Do you believe in that stuff? Do you believe that visualization can actually help you with your prepare you well in whatever you're visualizing? And I'll tell you why I'm asking. There's a famous coach but answer that for me first, and then I'll
Or is that something that you've ever used?
Yeah, we do visualization a lot in the ER, right? It's a big thing, right? In part because we have these things that are called halo moments. So high acuity, low occurrence. It's a rare thing, but it's got to go right, and it's really, really impactful, right? And so you don't get that many chances to train on those things because it's expensive, or it's hard, or it's dangerous to train on them, or whatever. So yeah, a lot of that is visualization work. Like you know, you take it apart, you think about it, you put it back together, you run it in your mind again. You and I have done this before when we're drilling, right? We'll drill, we'll stop from there and be like, okay, the next thing is going to be this, and like, okay, let's run it backwards. What comes before this? What comes after this? And like, what's the like piece that comes in between that? And like, I think that's a really important piece.
I absolutely believe that if you're going to like a jiu-jitsu competition or even wrestling or to a lesser degree striking match, because you might get hit in the process and that changes the whole thing, right? But like you might get hit hard and that changes the whole thing. But I'm talking about something like we're more familiar at least with. I firmly believe that if you're going to compete, visualization won't hurt, because you will have essentially what you're doing is building a game plan, and you will know how this will happen, because you have your favorite, like just to give you an example, in our world you have favorite 1 or 2 takedowns, and they're usually like one is the result of failure of the other, right? As a chain, and then
that's very smart.
And then where you get after that, like, well, I usually like ankle pick, and then I get a little to the side of him, you know, so I'll try and get to the side and all that stuff, and then you can actually visualize based on your past training.
100%.
But you can also visualize a scenario where you don't exactly know, like, well, what if I trip in the process, you know, then maybe, you know, he'll fall on top of me, maybe I have to turtle up and go up to all fours and then start from there. And when that happens, you actually, it's like you've been there, you know what I mean, which you have in the training room,
You have.
but we have, that's the difference, right? But I'm saying, like, with something that
But I
doesn't,
think the visualization can mimic that to the point
correct,
where
because
it's equivalent to being there again and again.
because
and
your
kinda drilling it.
takedowns, you might fail on the takedown, but you're not gonna slip and fall and then end up in a bad position. Whereas if you visualize it, you're gonna be like, the moment you slip and fall on the way down, you're gonna be like, of course, because you're trained too, but it's one of those rare occurrences,
Right.
right?
Yep.
Unpredictable too, but you actually predicted it,
Right.
you know, in a way that you can handle it. That gives you an opportunity to handle it later on.
So there's this debate going on right now in like medical education. How much should you tell people what they're about to train on or not, or should you surprise them with it? So if you know, we leave the gym, we go to the hospital. Okay, I'm going to train you guys on how to do a thing. Here's the skill. I'm going to give it to you, and then I'm going to put you in a scenario. Should I tell you that this scenario is going to be hard and different, or should I just let you fall into the trap yourself about it?
Hold on. So we're trained on, like, on everything as doctors.
So here,
But theoretically,
let's run a jiu-jitsu example as opposed to a
Okay.
medical example.
yeah, because we're simple folks.
Ditto, right? So you teach a class and you teach us a basic takedown, or you teach us a whatever, a Kimura or something. And then you go, okay, Dan, I'm going to teach you this Kimura, you're going to practice it, cool. Now we're going to partner up and you're going to go do it. But what I don't know is you've already taught Ian the counter and the counter and the everything else, and Ian's just waiting for that to just take me apart when I go for that move. Does that help me? Is that good? Or should you be like, Dan, here's the Kimura, I've taught Ian the counter, right now you guys are going to go back and forth over this one area and see what happens. And that's a debate about, I don't know that there's like an answer to that, but like you could see both sides of like what would be better training or worse training. And this is this is a pretty active debate right now in medicine. Like, how do we train the juniors? How much stress should we put them under? How hard should
I think I like the first one in that. Okay, you know this.
But
He
knows that.
this, so just do what you do. Keep doing that, because I think what happens, or at least with me, one thing that I've had to deal with over the years of having to learn stuff and relearn it and learn it and get comfortable with what I'm learning, is if there's another variable, as in if it was okay, I'm taught you this, but he's a black belt. He knows exactly what you're trying to do, and it's going to be so. But just worry about all you know about. Now I'm like, oh gosh, now I'm gonna get fucked smashed. Instead of being surprised, even if he is like this badass, he knows everything. If I'm just worried about the technique rather than worried about, oh no, this is gonna be heavy duty. That's kind of leeching energy away.
Control the controllables. Find what you can do and like practice.
And I think if you just stay focused on just learn this. And all that other stuff, don't worry about it.
Yeah.
With the type of person I am, because I'll get anxious about stuff. And then it's like, it's tough for me to get my focus back.
Sure.
Especially in competition. That's one thing that I wanted to keep training at after my wrestling eligibility in college ran out. Because I'm like, man, when I look at a dude that I consider a competitor, they still might be like nervous and stuff. Like I get nervous, but they deal with it in a different way because they perform. And I'm always like even in your last tournament, I was like, damn. I was like, why? I was like, he's performing, even if he is nervous. But I think about other things, and I think when I accept information and when I can perform at my best, it's when I'm not worried about. Even if it is like something that I should be, it's like.
I think that's where visualization actually helps, because
100%.
because your training is based on what your mind tells you. Like muscle memory is one thing, but if you do with me the drilling and let me ask you please remember what so I don't forget, because we're not taking notes.
We don't take notes.
We're literally sliding down the hill. Yeah. So
it's great.
You just said, but answer me that after that, please. You just said that. the example how you teach the students. You gave a jiu-jitsu example, but
Yeah.
I would like to hear an actual medical example when
Sure.
you study. But let me ask. Let me just share this. Like when you're drilling in jiu-jitsu, I feel that, and a lot of the talk right now is about the ecological method of studying and teaching, where they just throw you in a certain scenario or in a certain environment and tell you deal with it. And but when it gets to this point, you stop and you try go back
real
go
rigid.
back. Yeah, very yeah. But and it's ecological or what not. It's
positional
called
sparring
experience.
kind of thing.
It's a positional
much.
sparring, but
Okay.
very.
But
very,
there's rules for
with a
both
lot
sides.
of limitations. With a lot of limitations, like for example, if I'm going to be choking you, I can only choke you this way. I can't really do anything else, you know. And until failure, and then I have to go back to it when you defend and when you fail and when I fell. But the thing is, I actually believe that people are bad mouthing drilling, like the drilling that we do, to a big extent because people don't think throughout it. And again, drilling builds muscle memory. Muscle memory works only when the same kind of event kicks in.
Sure.
Happens so that your muscle memory kicks in, right? So if we're drilling,
Or similar.
or very similar, without many variables, that's the thing. But there's always variables. There's always different body type. Maybe you drill the move like 60 fucking times on the same person, but then you drill it, but then you end up with someone bigger, and you can't step over that guy. You know what I mean? Or your knees don't reach the floor.
Or
you
you
know?
have to do something different.
Right. So, or they give you a different reaction to what you know, because the coach told you the most common reaction is going to be this. Like today we did the frame, you know, that's the most common reaction. But some guy does something completely different, and then so that's why we do like test and trial and error, you know, which is the ecological effect.
Which is
But if you actually put your mind into the drilling, I've noticed, and that's how it works with me. When I drill a move, you know, you drill it like whatever, like I can drill it like maybe 10 times or something, and I'll have more success with it than someone who drilled it probably 50 times, because I actually think through it. I put my mind into it, which is similar to what visualization is in my case.
Yeah.
And then I can run it through my head like a million times after that, you know. I have that memory for it. You know, it's not just a muscle memory, but my mind works on it as well. So with me, drilling is different than what it could be for other people.
I think though that like part of that's also that you're experienced enough to have a frame to put the stuff in, right? So like you understand the concept of pressure, and you understand the concept of not crossing midline, and you understand the concept of you know, moving a thing to move something else over here.
Right.
Because you have those building blocks, you can then build those things into a tower or a car or whatever it is. But you think about how like when a white belt comes in, when they don't have that, you're like drill, and they're like, well, they don't understand. Well, what's the important parts to drill?
Correct.
Like, how do you?
Okay,
frame
so
it?
that's where the
Yeah.
ecological people or ecological
Yeah.
supporters are talking. Okay, you have a white belt. He doesn't know the concepts. He doesn't know why he needs to off balance you this way in order for you to move that way and that move to work. You know, because all we do is we do this, then we expect our training partner to come back, and then we lock the triangle, which is all nice and solid until it doesn't happen because our training partner is not doing it. But a white belt, like a beginner, he doesn't understand. They don't understand why we have to do that, why we have to off balance and all that, because they don't know the rest of the bigger picture of it, right? Now, but here's the thing. As a beginner, you can also think through the move, right? And that's my point. You can think through the move. Let's see an example for a takedown, for example, some kind of takedown, right? From wrestling. We need a certain amount of push into them. We lock up into a tie, you know, hand fighting and collar ties and whatever. And coach says, we're actually going to go underneath, like we're going to duck under and go to a double, or duck under and go to the back. Well, you need to duck under, you know, you need to get their arm. It never fucking works in live sparring. Why doesn't it work? Because when we drilled it, coach told you have to push, and when they push back, you do it. And you drilled it that way, but there was always this, you push a little bit and then push a little bit, and then you do it. You push a little bit and then... And you have to actually think through it, not just rely on your body, because at some point it becomes boring. Drilling becomes boring, and if you stop thinking about what you're doing, you're actually losing. You're losing. So you're not concentrating while you're not focusing while you're drilling.
And it gets easy. It gets easy to get bored.
Yeah,
and focus.
And that's the negative about drilling. It gets boring, but
that's a good point.
But if you actually find it interesting as to and
also if you have a good partner,
it makes
a partner makes a big difference. But partner makes a big difference for everything. You know, for it doesn't matter what you really are.
Because if you have a lazier partner, it makes it tough. But like when we were together a couple times,
well, we're always like, okay,
we would be talking about stuff. Like it was like we were having an active session.
Going back
that's
what I'm saying, because you're involving your mind 100%. Into the actual thing.
Yeah.
And 10 reps for each of you is enough compared to, and that also comes with knowledge. You're absolutely correct. It comes with knowledge, but it also comes with, you know, like, why is it not working? It's because I'm supposed to push in order to get a push back, you know, in order for them to lose their balance forward, and you know, so if the drill is only when you push and they push back, you step to the side and they go flying. That makes a lot of sense. You know what I'm saying? That'll make a lot of sense to any noob, you know, any beginner. But when you actually involve the rest and they're not thinking about that push and pull, which is the actual push and push back, which is the actual most important part of the drill.
The instructor needs to kind of break that down as much as possible. And also, the more experience, I was talking to Sasha about this today, I remember the third time that I was instructed on how to do the straight footlock from Gustavo. I remember the third time. And it was at that point, because I thought I had it pretty good before, but on that third one, it was like, everything came together.
Something clicks,
Yeah, and I was like, now I really have it. I know when to fall back, and I know, it's just like, I got such a higher awareness. And I think that comes from, it's a cumulative effect oftentimes.
Cumulative, yes, correct. But it also came with drilling. Right?
Sure.
Drilling and thinking about what you're doing.
Every single, like I thought I had it pretty good the second time, even the first time I thought but it was, I had it really good. You know what I mean? And I thought that was pretty cool. Understanding, like looking how I learned something.
Yeah.
Like, oh man, this is the third time. And
I'm fascinated by learning and teaching techniques and methods because I know that there is no right or wrong way.
Right.
You know, there's no right or wrong way in my opinion.
It's kind of like
when you say there is a debate, you know, in
can you give us an example of a medical one?
Totally. But have you guys ever read Josh Waitzkin's book, The Art of Learning?
No.
This guy.
But I've heard of it. I think from
somewhere.
I've heard somewhere. I think Kid Dale talked about it or something. I can't remember.
Could be.
He is about that.
He's all about learning and stop drilling and all that stuff.
Yeah.
A low extreme.
This guy was a chess champion who then went on to be a Tai Chi champion and then went on to be a Jiu-Jitsu champion.
Wow.
And one of the things he talks about is the idea of like, basically like compression. So like when you start, like that example you gave, like you push, the other person pushes back. The first time you do it really big. You're like, I'm going to push you, you're going to push me back. I'm going to push you, and then really big. Okay, now you understand that there can be opposite reactions to forces. When you get better, you realize it's the same principle, but it's done compressed. It's small. You don't push the whole thing. You just sort of...
Like it's more nuanced.
It's more nuanced, but it doesn't mean the concept's wrong, right? So you train it where it's obvious, and then you compress it to where you can actually use it sort of in real life. And there's some... I don't know. There's some bridge for me in that between, like, what you're saying about, like, how do you drill and why do you drill, and then how do you learn a concept and then apply it to a thing and then deploy it in real life.
Yeah.
Right? And maybe the bridge is this idea of sort of like, you know, really honing in on it.
And breaking it down into pieces.
Yeah.
You know, I'm going to give you another example with...
give you a medical.
Yeah. There is a I don't know what it's called. It looks like you're gliding. It's a step in boxing. It's a footwork in boxing, which... Mike Tyson used to do with the hop, but it's actually sliding. You've done some stand-up, right? Mm-hmm. It's it's to change an angle. If you're standing in front of your opponent and you're doing, it's a close quarters combat, so it's like kind of like pocket boxing in the pocket. So if you want to change the angle, if you ever watch Mike Tyson, you'll go like bam bam bam, and then you'll change the angle with a hop to the side. So you can do the hop. He used to do the hop just because of his his changing of the shifting weight left and right, but you can do it with the sliding of the feet like this, right? So I saw that somewhere like years and years ago before I started doing jiu-jitsu. I saw that somewhere on YouTube. Some a boxing coach, like some Israeli guy, old guy, was teaching that, and I'm like, wow, this is super interesting, like how he does that. It looks so easy, and the guy's old, and it's like so mobile, like he was in his 60s, and I'm like, fuck, this is interesting. So he showed it, but he didn't show you why he does it. He's like, you just have your hands here, and then you do it, and then you do it the other way, and then you do it this way, and then you do it the other way. The difference is that I knew why he's doing it, because I know that you can throw a hook from there or throw an uppercut. If you show it to someone and you just tell them do it without any particular reason, they won't know why. So it'll become very boring. However, if you teach the full, you okay?
Yeah, I'm good. Thank you.
At least we
got
got
a doctor in the house.
I'm sorry, it's the first time you heard that joke.
That's good.
If you go to teach a class and you tell them, okay guys, everybody on the bag, and everybody's gonna do this, 1, 2, do the footwork to the side, and then throw another 1, 2, and then do the footwork back, and then do another. So you're creating angles and throwing punches before and after the angle, and it's like everybody's gonna be confused, because of the fact that you're showing the entire technique, and you're not just teaching the footwork.
Sure.
You should teach the footwork first, and then show them why how this footwork relates to the punches. And now this is something that in wrestling I think would be also helpful, because if you teach the push and the pull and then the duck under at the same time, everybody will say, okay, so I push and I pull, I just push and push back, everybody will be, but just like we did, I push and then you push back. Look, there's nothing here. We're just drilling because we don't want to really push and push back too hard, and we don't want to hurt each other. And you're not gonna hurt anybody, but if I actually start pushing and you give me a little resistance, that's actually gonna work.
Yeah.
Right.
But it's not gonna work with just this. And you gotta explain to people that this push and push back is really powerful thing.
Okay.
Before you show the actual duck under, you know what I mean? That's my point. Yeah. Break it down into pieces.
How much, when you teach a class, how much do you want them to learn in that class?
Oh, it depends on
how big of a packet of information then is like the right size?
So for me, it all depends on the size of the class, who is in the class, because you know the students.
Sure, right.
And
faster or slower,
yeah,
or whatever. Yeah,
and also the time,
no information.
how long I have, because sometimes we just don't have, like, we usually have about 20 to 25 minutes, and you can't really teach too much. But if I have like you guys, I have Ross there, and I have people who are just more experienced. You can skip through a lot of the initial mechanics of a sequence. Let's say you teach a sequence, right? Some kind of sequence. Let's say half guard sweep of sorts. With beginners, you gotta explain to them how to do the half guard with a knee shield. With you, I don't have to say that. I'm gonna say go to a low knee shield because it's not gonna work from high knee shield. And you're gonna be like, that's why it's not working, because I'm going with a high knee shield. Right. Okay, I'll go to low knee shield. Now imagine having this conversation with a third week guy.
You gotta explain more.
Go to a low knee shield. He's gonna be like, what?
Right.
Yeah.
And then he's gonna lose the whole thing. So it all depends. But I believe that a new guy will learn more from distinguishing a low knee shield between a low and a high knee shield.
Absolutely.
And how to maintain that position, then benefit more from that in that class than most people will benefit from the entire technique, even if they're more advanced, because his learning curve is barely starting, and it's going to go from here where he doesn't know what half guard is to actually here, whereas yours, you might not even get the technique because it might not be your thing. It might not be a sweep you're comfortable with. You might not be into like John Wayne sweeps and stuff like this. So you're going to be like, well, but you got to take something out of that whole sequence too. So what are you going to take out of it?
The answer to your question, kinda, if this is possible, about how much are you is as much as they can master as
sure.
much as they can wrap themselves around and understand
Yeah.
whatever that is, because it's going to be on a scale according to the aptitude of each student.
For sure.
It's going to be closer to some. Like if it's me and you and it's in some white belt, it's going to be different.
Right, obviously. Yeah.
But
Yep.
Do you know this? You guys were not in the morning in my class, but do you know this technique where you're in a side control cross side and a guy bumps and gets an underhook to start going for the escape, right? The underhook escape from side control. So you have to block the escape, block the underhook, and then spin around him and take the back. We've drilled that with Gustavo and all that. So I showed that drill, and I look at the room, and everybody is like at a position where they can learn that within 5 minutes. Whether it's gonna work out in live roll for them, it might not. So I told everybody this is very specific situation. Very situational specific thing.
But fairly
However, the escape is very common, the underhook escape, and you got to know how to counter it. And unfortunately, most people do is they throw an overhook when somebody throws an underhook, because that's what we're taught, right? I mean, it's a no-brainer. But when you start escaping with an underhook, you're rarely gonna escape with that high an underhook that I can get an overhook. They're usually gonna go low and then take a single or take the back from there, and you're not gonna have a good. So this is an actual mistake. So I told everybody, even if you don't get that spin around move to the back, really doesn't matter. If you did get it, great. If you can hit it in a live roll, great. But if you didn't get it, just remember that when they start escaping, you have to block their hip.
Right.
Block their hip so they can't escape. And then worry about what you do next. You might not even do that. You might just decide to flatten them out. And that's another option you have from there. I really don't care what you do from there. But if all of you take, there was 12, 14 people. I said, if every one of you learns this, I don't care about the rest. I think that everyone learned something.
Block the hip instead of go for the overhook.
Yeah, I'm just saying, in this case, that was the most important part of the move.
Sure.
You can't do the rest of the move if you don't do that part.
Right.
But that's also a very important part of a conceptually important thing, right?
See, this is why this is also freaking interesting to me, right? Because this is a laboratory for how to learn a skill,
right?
And then
100%.
apply it under pressure, right?
Right.
And every day you get to show up and you get to practice the thing. Okay, I'm gonna try this. I don't know what he's gonna do, but I'm gonna try it.
Right.
And then I'm gonna play with it and be like, well, did it work? I don't know. Well, why not? Let's go figure that out. And then you sort of keep moving and keep moving. And I remember when I first, I had done some training as a kid, but when I really first started back in here, when you and I first met, right?
Yeah.
I was like, I'd be like, it's like playing chess, but you don't know the rules. I lost. I have no idea why. Literally no idea what happened. I'm like, why am I upside down?
Yeah.
Sean's spinning on his back like a turd. I don't understand anything that's happening.
Yeah.
And now there's a little bit more than that, right?
Yeah.
Now there's enough where you can just start problem solving, and you're like, okay, this didn't work. Why? Let me go tackle that. And that's just so fucking cool.
It's
That's
so
cool.
cool.
And that's this when I teach medicine, that's what I want my doctors, my teams to have, is that hunger to figure out what's coming next and what's around the corner and why and how do we get better at it, and that problem solving thing to it. So
Give us an example, please, with the medicine for the.
So one of the so you can break it. You think a skill, a particular skill, right? So one of the skills we have to do is we have to put a breathing tube in. Somebody's going under anesthesia, you have to connect them to a ventilator. Maybe they're maybe they have a brain injury and they can't breathe, or they're having a stroke, or they had a heart attack or whatever, and they're unconscious. So you got to put one of these breathing tubes in. So a lot of what that is you're positioning the person's head. You're using this blade that's sort of shaped like a J.
Oh my God, no.
It's not sharp. It's dull. And you're sort of moving your way in so you can see their airway, and then you're threading a tube in. So there's the mechanics of it, right? And so when you start, you learn the mechanics of it, and you learn it on a mannequin. And it's just, the mannequin's just a head and a neck, and you just drill it over and over again. Okay, you're doing it. Where's your weight? Where's your body? How are you looking at it? Where are your eyes? Where are all the things, right?
But a mannequin is not busy dying.
Mannequin's not busy dying, right? Which is great, because it gives you the chance to do it over and over and over and over again until you understand it and you feel it. And then in some of them, they can actually make the mannequin harder. they can make the airway narrower, or they can change the angle
Variables.
and make it harder, right? Okay, now you can do the same thing but like this. Now you can do the same thing but like this. And then you start doing it on a larger mannequin in the middle of some other thing. So, okay, you're doing this whole scenario, the patient's coming in, it's a bad trauma, you gotta run the whole case. Now you gotta go do this skill that you practiced. Go do it right now. Like, no timing, no anything, do it, okay, bounce back into the thing. And so you're practicing moving from seeing the entire field to seeing like one little leaf and like sort of tackling that piece of it and then back and forth. And one of the training sets we did that was so cool and gets to this idea of like how much should you tell them about what it is, right? Is you would design antagonistic training. So we'd both be training. You would say, okay, guys, today you're going to train putting an airway in. All right, so here's the one that's going to start. I'm going to watch you do it. You're going to watch me do it. We're going to judge each other on it. Now you get to introduce variables to make it harder for the other person.
You do that to him, right?
So I'm going to be like, oh yeah, man, the patient's on the ground, so you got to do it lying on the ground instead of standing up. Go. And you're like, fine, they're on the ground, but it's on a ship, so they're rocking. And you're just like trying to make it harder on the other person, and it was ridiculous. It got to this crazy. Okay, you're upside down, and you're wearing a hazmat suit, and you're like, there's some picture of me somewhere doing this where I'm like literally wearing a hazmat suit, and I'm like lying down trying to get this thing because that's what the challenge level got to.
Right.
But that ability to take a drill and then iterate on it antagonistically and be like, here's your next challenge, here's your next challenge, here's
That
your next
has
challenge.
to help you when it's real. When it's a real person, even if it doesn't have any craziness.
No, absolutely.
That real person level gets.
But it makes you think though. It makes you
How would you do
makes
it?
you think because if you do, and that's the whole thing about the drilling as a sole mindless drill, execution where we're doing this, we're doing that, without any variables. And variables don't have to be introduced right away, like you say. You got to do it little by little. But then once you become good at it, it becomes boring. If you don't become good at it, in your case, you got to become good at it because you're gonna someone's life is gonna depend. It's part of. In our case, you don't have to become good at an arm drag because you might just not be, it's not your thing. You're good at shooting at a double leg without trying the arm drag.
And there's stuff in medicine like that too, where you can choose paths left or right, and then there's some stuff that you just have to be able to do.
Right, correct. So, but with us, it's not a big deal if it doesn't work out. Right, that's the difference.
Sure, unless you're fighting for your life, in which case, like,
of course.
Yeah.
But if you're fighting for your life, you're gonna be doing exactly what you've done like a million times without doing anything, without
You're not doing flashy stuff.
Stuff. Yeah. But you're gonna bring your A game instinctively, which is muscle memory. But the thing is, you're in the example that you gave, you're presenting challenges to each other, and you're making each other think.
Yeah.
Think about the variables in a certain situation, not necessarily introducing different situations only, but variables in the situation. What if the patient is this way? What if they're that way? What if they can't move because how maybe their spine is fucked up or something? They can't move. They're here. How are you gonna do it? You can't do it if you haven't been there. If you only train it this way,
Right.
you can't do it if you.
That's a real one.
And so. And that's where people start thinking about what they're doing rather than just doing it.
So but so here's the thing, right? So I remember that day when we were doing it, and I remember laying on the floor upside down trying to figure this thing out. And I'll be like, I'll probably never be here. I'll probably never be wearing a hazmat suit. I'll probably never be on the floor upside down doing it. And then COVID happened, and I was working in a place up north, and for a while we weren't. If somebody was really sick, we weren't bringing them into the ER. We were sending the ER doctor out into the ambulance. And so all of a sudden, instead of working in the ER, you're working in the back of an ambulance.
Wow.
Very different scenario. And so I remember this one day I go out there, okay, I got to intubate this person right away. And I ended up having to do it kneeling down.
Do what?
At this, putting a breathing tube in. Sorry, it's called intubating. Doing it kneeling down in this weird angle. And you talk about visualization. The moment before, I was like, okay, I'm going to have to do this. It's going to be in a weird space. How do I do this? Well, I had two thoughts. One is I know how to do it really well when it's normal, and this is not normal. But I have a big database of other crazy shit that I've done.
Right.
And some of that's been in training.
Yeah.
Right? And some of
Yeah.
that's been in training because I remember that day that I was upside down and wearing a hazmat suit and doing
You
whatever.
kinda cross-reference
And I figured that
stuff.
out. And if I can
Yeah.
figure that out, I can figure this out.
Right. Like right now, in the moment.
Yeah.
You know, and you're like, all right,
Because
well, so
you've
this
already-
is how it's going to look, right?
Yeah.
So part of it's the skill of how do you do it, and part of it's just the faith in yourself. Like, I did this, so
And
I
the
can make this work.
creativity to be able to
You
call
can.
upon that.
There is no substitute for experience, and that's how you create experience. You know, through
Yeah.
through
Smart drilling,
smart drilling,
visualization,
yes.
and you know,
yes,
this
people,
challenge.
and
Yeah.
and my problem with the ecological method is not the method itself, because the method works. It's great. My problem is people go into the extreme and not actually fully understanding what drilling is, because this is drilling. This is type of drilling. The ecological method of learning is a type of drilling. It's just different because
it's just
can't
different.
you can't learn.
It's more
there.
narrow. It's like
Yeah.
slices.
You can't without a technique. It's kind of easy when you're looking at two purple belts and you tell them, okay guys, you're gonna take this position and do it until one of you escapes. It's like, of course it's easy because they know the position, they know all of that, and then the white belts, give them something, throw them a bone, let them try getting that position, and then they'll figure it out, and this is also drilling. It's just drilling under different circumstances or under various circumstances, and yeah, that's a good example. You do something with that's a good thing. I gotta. It would be nice to think of a way to, but I've experimented with like a lot of, like you saw that, a lot of different like methods of teaching. It's not about the teaching with me. It's like to see how people respond best to them in terms of learning. So, and I tried a lot of different things and I keep getting back to the same, because I'm also trying to see what keeps people most involved.
Sure.
And that's that's what.
Because you've got to deal with people's ages. Some people coming for different things.
Sure. Yeah.
You got super casuals, people that are trying to do tournament. There's so much you have to.
You got people with injuries and stuff. People that don't want to. So it's really different. It's
all these are pointing at me. It's just like,
there's so many variables.
assholes and
Dan, what about you seem like you have, but the history of medicine, man. How is that? The history of medicine. Have you studied that?
a little bit, yeah.
Yeah.
What do you want to talk about?
It's coming.
Oh, it
Well,
sounds like you have. It sounds like you're interested in
Yeah,
it.
let's
So
do
I've
it.
always been fascinated by. You mentioned it earlier with the statues of ancient
People.
not the godfathers, the
Yeah.
fathers of
The
grandfathers.
godfathers.
The fathers and grandfathers of medicine.
Yeah.
But for me, it's always been really fascinating how obviously someone dies and there's always this one guy in the village that opens him up and he's like, all right. So that's how I learned to work on computers, to be honest with you. Not by someone dying, but by me opening up a computer, right? And then looking up stuff on YouTube and stuff like this,
Yeah.
which took me way shorter time and less risk than someone, trying to save someone's life and not being able to, and then
Dude.
the person died and you're like, why the fuck did I die? And then you see that there's
All
something,
guilty.
that, everybody's
Yeah.
blood is red until, and
Until
so,
it's not.
yeah. And how long did it take for like, give us an example of something that today we take for granted, and 2,000 years ago in ancient Rome was, doctors were just like dumb.
Like they didn't know
About.
about bacteria and stuff, about washing hands and stuff forever.
Yeah.
I think that's the biggest.
Hygiene.
Yeah.
Yeah.
Just
One
literally
second.
I heard the story, like one of
got,
the dudes that came up with that.
10-15 minutes, guys. Bro.
Yeah, of course.
He likes to go long.
I know.
No, you're good.
I got 7 a.m. meetings in the morning. I got.
Oh my goodness.
Yeah,
We're
so I
gonna-
gotta-
we're
You're
gonna
good.
bring
No,
you back.
you're good. I got nothing tomorrow morning.
Aw.
Always looking
Holding a
at,
bunch of
always
onions.
watching you all.
Yeah.
Oh.
Yeah, man. I mean, I think, in a weird way, this is the same question we were just talking about, which is how do you learn anything?
Trial and error.
Like, trial and error works great for some stuff. It works great for stuff where, like, the cost of failure is not that big.
Right.
There's so many opportunities to do it, and reality is somewhat repeating, right? So like, if I'm trying to teach you poker, it's really good trial and error,
example.
right? Because we can get into situations and I can be like, and here's the rule, and here's why this wins and this doesn't.
Right.
Now let's play it again. It doesn't cost you any money. It's okay. Let's try it again.
Yes,
Right?
yes.
You know, if we played a game of poker where anytime you drew an 8, somebody shot you,
It's different.
you can't play that game.
Yes, yes.
Like, it's really hard to learn that.
If
from
the
trial
odds
and
are
error.
60-40 in your favor, there's still 40% chance you're gonna get shot,
It's
right?
really hard,
It's a
right?
big of,
Yeah.
it's a bit of a problem.
So you know, one of the big questions is like really to be like philosophical for a second. Like, how do we think reality works? Do we think reality is predictable and learnable? Do we think it's not? And then, what are the pockets that are learnable, and can we go learn that? And how cheaply can we learn it? Right, so that we're not getting shot in the face every
Right.
time we draw an 8 and continue to play that game. Or if you play that game and you do it, I'm like, I'm gonna go play this game over here. Actually.
Right.
I don't think I'm gonna play that game anymore, right? So like that's what, you know, in some sense, that's what medicine was, right? You get to go up to bat over and over again only because we wrote shit down and then handed it to the next person.
Yeah.
So you maybe see 5 cases of whatever in your life, and you see 5 cases of whatever. Now we can talk to each other collectively. We'd be like, you know, out of all of our combined data, this is sort of what we put together about it. But that didn't used to exist.
When did medicine become like modern, kind of? Was there like a big shift at some
There's
point?
you could make an argument that
Like maybe when it went from like focusing on religion to science. Maybe?
yeah, I mean, some people would argue that like the cholera epidemic in England with Jon Snow, not the Game of Thrones Jon Snow, but the other one, that's when basically the first time they mapped out who was sick and drew it on a map and sort of realized, wait a minute, the common thing was drinking from this one well of water. And that was sort of the first time that they went. And there were people that were like, that's ridiculous. Disease can't be carried by water. Disease is carried in the air.
Right.
It's the evil smells. And so there were these two sort of schools of thought, and they actually just did the math and were like, oh, wait, it actually looks like it's supported by this. So that was one of the big ones. And I actually got to go see that water pump this year in 2024.
You
yeah.
wear a mask?
No.
Hey, just in case.
I'm just hedging my bet.
And 95.
That's hilarious, man. That's actually really good. I wish I thought of
do you
that.
think? Do you think in the time of the bubonic plague, do you think they knew it happened from rats? Was carried by rats?
Oh, I don't know much about that. I don't think so.
I would guess
don't think they
probably
knew that.
not.
Probably not. We know now.
I think they thought it was like a curse.
Right.
Or
Because
something.
yeah. It's crazy to me that centuries and centuries people were clueless about
Well, a
and
guy that had the
drawing
idea
blood,
about-
drawing blood and stuff.
About infection, he was a guy, and he got ridiculed
Yeah. This guy,
to the
right?
point where he died, and he had proof, and they were just like, "That's stupid."
He died in an insane asylum.
Insane asylum.
Yeah.
Yes, I
this guy
felt
that
so
proved
bad
that
for
washing
him.
your hands would decrease the
And
risk
after
of
he
infection.
died,
Yeah.
it kind of became like, "Oh, he was right."
That's crazy. It's wild.
It's
to
such
think
a
about
great,
that.
it's such
Yeah,
a
that's
sad
not
story.
That long ago,
It
honestly.
wasn't really.
There are people.
That was like in like the 17s, 18. It was not the 18s.
No, it was earlier than that. I think.
Like 17s. It
Yeah.
wasn't like 14s.
Yeah.
I'm not good with that kind of information.
There's
I don't know.
people to this
Yeah.
day, not to this day, but even nowadays that don't believe in soap.
I mean,
Yeah.
Yeah.
But anyway,
people still getting staffed.
That's what we're gonna end
last
this on?
question.
All right.
That's what we're
No,
gonna end this on, right?
last question, and you don't
Sponsored
have to.
by
Yeah. Defense soap. Defense soap.
Sponsor us, please.
Sponsors.
question.
Last question, and a real quick one. I would have loved to speak about staph infections and stuff because this is
We're
something
gonna do
that.
it for the second
but-
when we bring them back.
Now that-
But maybe
Yeah, absolutely.
maybe we can do that again.
You should use soap.
You should use soap. Yes.
Just to clarify.
Professional.
Very
It's not
very.
even medical advice. That's just life advice. Just use soap.
Yeah, we got a doctor here. If you have any questions, doc, how about soap?
I think I'd be answering this. Yeah.
What is the situation, in your opinion, in the United States of America right now with healthcare? We told you we were going to ask you that because this was last week we discussed a lot of that, and that's because of the murder that happened. But how does that affect Do you? The question that we were thinking about is, from your perspective, and you might not even know. From your perspective, is it cheaper for countries with universal health care per capita, because the population of the United States is humongous compared to other countries, right? Countries with universal health care, is it cheaper for them to provide universal health care at no cost whatsoever than it is to the American government currently? Not to people alone, but to the American government, because how many people in America do not step in the hospital because they're afraid of the bill? If they don't have insurance, or even if they have insurance with all the deductibles, copay, like huge copays or deductibles is what the biggest problem is. You know, and how much does that limit actually? How much does that cost extra or not to the government? You think?
All right, so let's put some frame around that, right? So like,
and we can end on that note.
The large question of like what's best, I don't know that anybody's like totally answered yet, right? There's a lot of different systems that we see. We see the Canadian system, we see the some of the European systems, we see the U.S. system, and there's no free lunch. There just isn't, right? We're always making trade-offs between different things in any sort of a system that we design.
Higher taxes versus...
Or even like accessibility of some services versus the ability to pay for them, or wait time versus this, wait time. Now, like, I'll say this. In the ER, we don't care who you are or what insurance you have, or we don't care if you're here legally or illegally. It doesn't matter. You show up and we're going to try to help you.
Yeah.
And that's really important, right? Because I think all of us, no matter your stance on politics or economics or whatever, we want to live in a culture where if somebody has a heart attack in front of you, you go help them.
100%.
You don't look at their wallet and decide what their insurance is, and then you help them.
Right.
So we've all already committed, in some sense, to living in a culture that provides universal health care.
Right.
We've just provided it at this level. What's crazy to me is that, let's just run this as a hypothetical. So,
but that's also the law too.
Well,
you cannot deny them. You cannot deny them medical attention, right?
It's true. It's
medical service.
It's called EMTALA, the Emergency Medical Treatment and Labor Act, which dictates that. But so, all right. So you got a guy that's having a heart attack, and he's going to have he's having a heart attack right now. We're gonna help him. But yesterday.
Are you talking about at the hospital or
I'm just saying, like, we're good humans. We all want to live in a society where somebody's bleeding to death in front of us, we're going to stop the bleeding.
Sure.
Right? Or they are choking, we're going to try to give them a Heimlich. Or they have a heart attack, we're going to try to help them. Whatever. We're going to do CPR, like you said. And we all agree on that. But what's a little crazy about it is that yesterday, what if you could have given that guy a pill that would stop that heart attack today?
Right.
Right now, we don't all answer yes to that question. We say, well, we'll take care of him when he falls down, because that's the right thing to do. But this isn't really. This sort of depends on if he has a job or not.
This is the repair rather than prevention.
And this is so much more expensive than this is.
Right.
Almost all the time.
Right.
Almost all the time.
Right. But
so
that's.
In a way, my answer is like, generally speaking, I'm not an economist, right? But generally speaking, access to healthcare earlier is cheaper than waiting until things get wrong.
100%.
For the whole society, for everything. Both in terms of like actual cost of providing the services, and then also in terms of like lost productivity and years of suffering from a thing before you're getting the thing.
Which people don't really talk about probably because it's not money. You can't measure it with money.
It's complicated, right?
It's complicated.
Yeah. But, so, I would say most doctors are for universal health care because we see it when it goes wrong. Even though we understand if we had universal health care, there'd be some areas of the system that would be more worked and some areas that would be less worked. And we'd have to do a bunch of changes. It's not enough to wave a magic wand and be like, everybody has health care. Because you're right, everybody would be like, cool, I'm going to go to the doctor. And you're like, well, but that's actually not what you need. What you need is like an exercise program, or what you need is like, primary care out in the community, or what you need is like whatever. And like, there's all this stuff that would have to change for it. And I think we can get a lot of models from what other cultures are doing outside of the States and take some of the best pieces of that. But I think it's kind of crazy to say I'm going to help this guy, but I'm not going to help him yesterday when it would have been cheaper to do it.
Do you
and
think
I realize it's a simplification. But
but it is how it is, because if you get a warranty for your car, not extended warranty, but when you buy a new car, it comes with a 4-year warranty or whatever, or 3-year warranty. Within that warranty, they give you a free oil change, right? Usually. Free oil change every 10,000 miles. They call you to give you the free oil change. Ask yourself why. Why don't they charge you for that? Because the warranty depends very much on the performance, on the running of your car, and that depends very much on oil change, you know.
Yeah.
So they want to rotate.
Like,
they want to rotate your tires for you for free. They want to change your oil for free, so they don't have to pay.
Yeah.
You
to
know,
overhaul it.
right. So this is, I know it's a simple example, but like similar.
And when
but
you
simple.
scale that, it gets so much more complicated.
Now we're thinking about millions of people.
Yeah.
Right.
We're talking about billions of dollars, right? And to me, the last question here before we leave is related. Is it too late because of the way insurance companies and not just insurance companies, but the medical insurance plus drug companies? Is it
Like
too far?
profitized
Is
it?
it too far down the rabbit hole already for us to dig out of it and you know? And
How could that be true? That'd be giving up. Like,
you
to
gotta
answer
be
yes to that is
optimistic, but
giving up.
It's still a monster, though.
Oh yeah, man, it's hard. But so is like going to space, and so is like inventing cancer treatments, and so is like everything else that we do, right? Like,
I love that.
what the fuck, man? Like, the answer has to be no. It's not too late.
You can't give up.
Right? Absolutely not. Like we're the same human beings that went from, you know, cutting people open to let the evil spirits out to having gamma knife radiation and super gene therapy and everything else. Look at all the stuff we've cured that didn't used to be able to be cured, right?
I think Luigi did a desperate act, and I think he kind of gave up. That's a desperate act to murder somebody. That's it's the wrong
murdering
thing.
somebody is despicable.
But I think he gave up, and I think it's contingent on the civilized population to be optimistic, but to kind of forge forward because it is a monster.
Yep.
Sure. And crazy stuff has to be done. I mean, I don't even know if the answer even exists.
there are
now,
hard problems, right?
But we, just like space, we were encouraged by Dr. Dworkis. We gotta go like Americans, put our head down and go and
do you believe
attack.
big pharma
In space?
and big pharma
I
and
believe in space.
big pharma and the insurance companies, do you believe they have no interest, financial interest in finding cure for cancer? And I know that this is there's many different types of cancer.
Yeah.
Right, so just saying it like that, because of all the treatments and the expenses related with the treatments that they actually, and the drugs, that ongoing treatment is actually pocketing, filling their pockets in a way, rather than
I don't think anybody that's watched people suffer from that would want anything other than that suffering to go away.
Well, the gentleman that got murdered was an accountant, although he was a CEO of a medical insurance division.
Sure.
The biggest in the United States. He was an accountant. I don't think he's seen many people suffer.
He probably hasn't.
Like medically suffer. I mean, like what you're talking about. Although everyone has something with someone relative to them that or friend that died of cancer and stuff like this, but we haven't really. Not everyone has watched them. Not everyone is. But I understand what you're saying. Of course, yes.
You go into a pediatric ward and talk to a kid that's not going to get to.
I can't stand the commercials.
Right, like,
dude.
With Sarah McLachlan, dude, that shit makes
Children's Hospital is the saddest place on earth.
Oh my gosh.
And,
I mean, I don't know if it's the saddest place on earth, but it's sad.
One of the most hopeful, also.
Yeah.
Right. Because that is the tension, like you talked about at the beginning, the light and dark side of it, right? It's the idea that so I'm gonna tell one story and then I'm gonna end it, right? So you can't promise your patients that you'll save their life. Can't do it. I'm not God. It doesn't work like that, right? And unfortunately, you can't even promise your patients that you're going to take away all their suffering, because we don't have those tools yet. We're better than we were, but we don't have those tools yet. So when you have a kid that's suffering, what do you do? What do you tell that kid, right? And to me, the answer that I've come up with over the years is that I can promise that kid I will not waste their suffering. Right? I will not waste their suffering. My team will not waste their suffering. We will never treat it like it's a drill that we're just fucking around with. Right? No, we're going to do everything we can for that kid. And if we can't save that kid and we can't take their suffering away, then we damn well better learn something for the next kid that comes in.
Right.
And I think if you take that stance from it, then that's the hopefulness, that's the optimism of being like, yeah, children's hospitals, there's a lot of kids that are going to suffer and die. And in 10 years, we're going to have more answers than we have today.
Because
so there's going to be less.
Because we're going to work hard.
Yeah.
Right? Because we're going to work hard. Because
love
we're
that.
standing on the shoulders of the giants that came before us from that.
Yeah.
You taught us how to find hope. And I appreciate that, Dr. Dworkis.
I just think they should lower the prices in the toy store in the children's hospital. At the end of the day, you know.
On that note, Dr. Dworkis has to save some lives tomorrow morning.
Thanks,
guys.
man. Thanks for showing up.
Thank you,
Thanks
guys.
for
I enjoyed it, bro. Love
and,
you, man. I
thanks for
enjoyed
training
that.
me.
after your
That was
interviews
special.
tomorrow, we'll see you in class.
Friday morning, yep.
Yep. All right.
All right,
That's
guys.
it for us, guys. Like, subscribe, and visit Dan Dworkis'
Follow this guy.
His
Follow
podcast,
his podcast.
The Emergency
please.
Mind.
The Emergency
Emergency
Mind.
Mind.
We'll
By
try
the
to
way,
put something in the
one of the first
in the
episodes,
notes.
or whatever episodes Gustavo was in.
Gustavo's on it, Pete's on it.
Pete, yeah.
Yeah.
So
We'll definitely check it out.
yeah.
He's
All
doing the
right.
Lord's work.
This is it. See you guys.
Bye, guys. Guys, that was
Thanks,
awesome.
bro.
So much fun.